Now we're going to talk about hypothyroidism. More commonly, hypothyroidism is a failure of the thyroid gland with no goiter. And hypothyroid is defined by low T3 and T4 levels. And most often in hypothyroidism, there is low T3 and T4, and there is elevated thyroid stimulating hormone. So the problem is due to failure of the thyroid. It is not making hormone in response to the appropriate TSH levels. This is called primary hypothyroidism. Primary because it's due to the failure of the organ named. In primary hypothyroidism, we see low T3 and T4 and high TSH. And this low T3 and T4 in the presence of elevated TSH indicates thyroid disease. Hypothyroidism due to an anterior pituitary dysfunction may cause a low TSH, and this is extremely rare and usually accompanied by other anterior pituitary disorders. And this is called secondary hypothyroidism. This is why elevated TSH levels are an excellent screen for primary hypothyroidism. So inadequate T3 and T4 production can be caused by a defective thyroid gland, in which case the hypothyroidism is primary, with low T3 and T4 and high TSH. Inadequate T3 and T4 production can be caused by a defective anterior pituitary, and this is secondary hypothyroidism. This is very rare, so these patients are unable to secrete TSH. So not only will they have low T3 and T4 levels, they will also have low TSH levels. So, inadequate T3 and T4 production can also be caused by chronic thyroiditis, and this is also referred to as Hashimoto's. Symptoms of hypothyroidism include lethargy, fatigue, personality change, intolerance to cold, weight gain, puffy skin, thick, dry, coarse hair, constipation, and menstrual irregularities in the female. Myxedema is severe long-term hypothyroidism. So myxedema is characterized by faces with dull, puffy skin, coarse, sparse hair, and periorbital edema or swelling around the eyelids. These people will also present with prominent tongues. Here we can see a picture of a gentleman that suffers from myxedema, and this is long-term untreated hypothyroidism. Cretinism, which is a neonatal hypothyroidism, will result in profound mental and physical retardation if the disease is not detected immediately at birth. And this is why it's part of the screening tests at birth. Now we'll talk about treatments of hypothyroidism. Thyroid replacement therapy with levothyroxine or Synthroid is the treatment of choice. Nursing considerations in patients starting Synthroid is that the nurse needs to consider that the metabolism of this patient will increase, and therefore their oxygen demands will be increased as well. So it's important to monitor cardiac function, especially in the elderly. We want to take complaints of chest pain seriously, especially in new Synthroid users. Now we'll talk about hyperthyroidism or high T3 and T4.